Hi everyone, I'm Dr. Z. I'm a clinical psychologist specializing in transgender care. Welcome to my channel. Let's talk about FOMO, which stands for fear of missing out, how it actually breeds a lot of anxiety, especially in a lot of you who already struggle with anxiety or any kind of anxiety-related disorders, and especially if you're prone to rumination, and how that's going to affect not only your well-being, but your decision-making when it comes to making decisions about surgical gender-affirming interventions. FOMO, or again, fear, if you don't know what FOMO stands for, fear of missing out, is today very, very prevalent. And one of the reasons why it is very prevalent is because here in the United States and in other parts of the world, gender-affirming care is starting to become more and more restrictive. When things that you essentially need, that you essentially are very dependent on in terms of you, not only psychological, but physical well-being, are starting to become inaccessible to you, that's going to always inevitably breed anxiety, internal anxiety. That anxiety is oftentimes for a lot of you is going to manifest in the fear of missing out, being afraid that you're going to miss out in your lifetime on something so essential to your survivalhood, so essential to your livelihood, so essential to your well-being, as access to gender-affirming care. Now, this could be in the form of hormones, or oftentimes it is especially in the form of surgical interventions. And another part of the fear of missing out is not only the restrictions that a lot of us facing in the world, but also when you are witnessing people that have access to resources. Let's say they have excellent insurance. Let's say they have money that they can spend on gender-affirming care out of pocket. Just go today to a great plastic surgeon and pay for gender-affirming surgery. Or let's say they live in a part of a world, for example, in California, maybe some other more, maybe New York City, some other more liberal states where access to gender-affirming care is not as inaccessible as where you live. When you're seeing other individuals being able to go through their gender transition and being able to meet those very essential for a lot of you, very important milestones. Now, when I say all of this, by the way, this video is for all of you who are interested in surgical transition. I always preach it's not for everybody and it's not a must. So please bear that in mind. But if it is something that you really want, you're going to feel this internal, almost existential crisis intertwined with fear of missing out, because you're seeing these people getting access to this care, you're seeing them hitting this with their own personal goals in terms of gender-affirming care, and as a result of witnessing that, they're going to mirror to you that which you do not have, and that's going to also bring you to the state of potential despair and depression, because it is very, very difficult when we see other people receiving something or being able to accomplish something that you yourself very badly need. So fear of missing out falls into these two groups. One, witnessing other trans individuals who have hit their personal milestones and have access to care. And two, what's currently happening in a world that infuses all of you with so much anxiety. This experience of sitting in an emotional flux of anxiety, depression, despair, that is all tied to fear of missing out, can really bring up a lot of feelings of helplessness, hopelessness. This is all pointless. What is the point of my life if I can never really live authentically? It can really bring up all of this really dark type of emotions and feelings, and some of you might already be having it. And that is going to make it that much more challenging to move forward, and that much more challenging for a lot of you to continue on your path. What I want to talk today is breaking it down into two groups. One group of individuals who know you need these gender-affirming surgeries, and you're sitting in this experience of anxiety, and two individuals who are not there yet. You know, maybe you're early in your gender exploration. Maybe you're still questioning your gender identity. Maybe you think you're trans or non-binary, or maybe you know you're trans or non-binary, but you're still not sure if you even want the surgeries, and how FOMO is also affecting you, and my suggestions on what to do if you're in this group. So let's look at the first group of individuals, those of you who know your identity, and those of you who know you need this gender-affirming surgeries, especially because you can feel the dysphoria is tied to it. Some of you even have very severe dysphoria tied to particular physical aspects of your body that you're really looking forward to modify. So here you are, this group of individuals who really know, and God, I know too that you all really, really need access to this care, and yet it is either being not accessible or it's being restricted, and you're having this existential anxiety that, oh my God, this is never going to happen. What is going to happen to you is that it's going to affect you, as I already said, in a multitude of negative ways if you allow yourself to sink in that despair. Now, I know it's easier said than done. I know that what I'm going to say is going to sound very easy, but it's really, really important for you to also to recognize that while there might be restrictions, I also think it's important to acknowledge that I truly believe this. I truly believe that complete eradication of gender-affirming care is going to be, it's just not going to happen. I truly believe that. There might be some more states that may restrict it for minors, maybe for some young adults until you age 25, 28, maybe, but to fully ban gender-affirming care, I have a hard time imagining that will ever happen. Bear in mind that if that were to ever happen, trans people found a way, always found a way, always found a way to hormones, to surgeries, to modifications. And yes, those finding ways were always challenging and difficult, and sometimes means people had to travel abroad, but people found those ways. So, and that's a very drastic scenario, by the way. So I want to first acknowledge, and for you to hold on to realities that the possibility of it completely being banned, I think is really, and I think a lot of my colleagues and people working in this field would agree, is I don't think that's actually going to happen. But it may mean that wherever you are, it may take longer, or it may take it much more challenging to get it because insurance restricting it, or you being put on a waiting list. So what you're really swimming against here on this side is against time. And I know that for a lot of you, time is something that's very important for you and very precious. As I said in one of my videos on importance of integration, take this time to work on your inner self. Take this time to integrate more. Take this time to really allow your authentic self to open up and to fully take room and to fully take space within you. Find other ways to express yourself. Find other ways to connect to yourself during this time. That's what's going to help you move through this time without really sitting in a lot of existential dread and without really sitting in a lot of anxiety. That's going to help you tremendously, tremendously. Is it going to make all the pain go away? No. But it's going to help you from not sinking into the despair of hopelessness, helplessness, and eventually thinking about throwing in the towel. So really, please try to also connect to other people who are in similar situations and try to focus. I always say, take this opportunity to even try to focus on other areas of your life. What other areas of your life? Maybe this is a good time to work on your health. Maybe this is a good time to work on your physical health. Maybe it is a good time to work on your lifestyle changes. Maybe it's a good time to reevaluate the way you cope and change how you're coping. This is what I would recommend for this group of people who are experiencing fear of missing out. And I think it's pretty darn hard not to experience fear of missing out, given what's going on in today's world. Now, for the group over here, which is a different group, now I'm talking about people who are exploring their gender identity or feel like they know their gender identity. But if I were to talk to you, whether gender-affirming surgeries are in your plan, you will most likely be ambivalent, or you most likely will tell me that you're not sure, that you may be feeling maybe some dysphoria, maybe you're not feeling any distressful dysphoria right now. And so you're not even sure. You think you may want some surgical modification, but you're not really fully sure yet. So here's the thing with this group of people, because you're still not sure, which is natural, which is part of the process, which is part of discovering yourself, fear of missing out, both in terms of globally what's happening, as well as watching other people going through transition and just quickly rushing through, is going to affect you on a different plane. What it's going to do for this group of people, especially for those of you who do have access to care, who do have access to the gender-affirming surgery, what I have witnessed is that people just move forward in spite of getting themselves to the point of being really sure. So it's going to bring up also for a lot of you the same existential dread as this group over here. But my caution is that if you do have access to care and you're still not sure, but you're afraid you're going to miss out, my personal opinion is to sit it out. Because if you're not sure to give yourself time, like I said, my belief is the gender-affirming care going to be completely banned. I don't think it's going to happen. And I think it's really important to allow yourself time to get to the point of not 100% certainty about gender-affirming surgeries, but some level of understanding how they're going to alleviate the distress and whether there's a distress warranted to be alleviated. Now, for those individuals who are in this group who don't have access to resources and also tend to be specifically prone to rumination, it can make things very difficult. The fear of missing out can make things very, very difficult for you, because when you're ruminating, you're getting yourself stuck in a cyclical cycle of thinking, trying to grasp for solutions. When you can't grasp for solutions, then you go through the cycle again and then again and again and again. And you wake up and you go to sleep with a rumination, and it makes things very difficult, makes it very difficult to focus on other things around you. It makes it very difficult to concentrate. It makes it very difficult to carry out your daily activities. So just like with this group, I also recommend to focus on your internal self. If you especially know you're not sure about gender-affirming surgeries, take time to explore. Take time to explore really pros and cons of the surgery. Take time to explore what they're going to be able to deliver to you, what they're not going to be able to deliver to you. Take time to focus on other aspects of your life. Like I say, gender is a big part of who we are, but not the only part of who we are. So it's important to focus on other aspects of your life as well. So this is what I would really recommend during this very big time of fear of missing out on all fronts, on both global front and seeing other people being able to get access of care. It can really feel very devastating. It's frustrating. It's almost like the food that you need, the essential ingredients you need are slipping right underneath you, and it can feel very hopeless. And it's, my God, such a difficult time for all of you. So I really recommend to take this time to focus inwards and take this time to focus on other parts of your life, because it'll just make bearing through this process easier for a lot of you. And for group over here who's not even sure if they want gender-affirming surgeries, the last thing I would ever suggest is rushing into them because you're afraid of missing out. Anybody who ever had gender-affirming surgery can probably attest to that it's a big thing, it's a big life shift, and like I said, you don't need to be 100% certain, but you have to at least have an inner understanding that this is something that you need. And when you're in a group and you don't even think that that's something that you need, rushing into it is not the best way to go. So comment below, let me know, how is all of this affecting you? How is this fear of missing out on gender-affirming care affecting you? I know it's affecting a lot of you. I have a lot of clients I work with that are really affected with it. They feel very stuck. You may feel like you are in the hamster wheel, going around and around and around and not getting anywhere with your gender transition. And that a lot of times can happen when our minds tend to fixate on this one particular thing that we need, in this case, gender-affirming surgery, and not really pay attention to anything else around us. So it's really important to stop the hamster wheel, because it's just going to really hurt you in the long run. I know, like I said, I know this is a very tall order, so I understand this is not easy. It's easier said than done. And my heart really goes out to you. I can only share with you as a psychologist from psychological standpoint what will be helpful to you, but also know this is very difficult to do, but it is not an impossible thing to do. So comment below, let me know how you're coping through this time, how you're focusing on yourself. Have you taken the time to focus on yourself internally? Comment below, let me know, and I will see you all next time. Bye.